Hi, I'm David Vinjamuri. I'm a trustee in the village of Pleasantville, and I'm home for the last week. My wife and I and our three kids have been self quarantining and keeping social distance, and here are two of them. This is
Tessa.
and
Colin.
and you can see about how well it's going with homeschooling. But the teachers at BRS are doing great, and we're excited to keep doing this. So I was very lucky today to speak with a public health expert, with Dr. Drew Harris. And we're going to show you that interview in a second. Dr. Harris is an assistant professor at Thomas Jefferson University. He started his career as a practicing doctor, and he specialized in diabetes. And then after September 11th, he went and got a master's in public health and has been working and teaching public health since then. The reason you may know of him or have heard his name is because if you've seen a graph over the past week or two that's been titled Flattening the Curve, that shows what happens to hospitals with and without social distancing, he created that graphic. So I interviewed him today to talk to him about the public health effects of coronavirus, some practical tips for managing our lives, and something about what to expect. So we'll keep communicating from the village, but here's a little bit of information from an expert.
The virus is heading everywhere. I don't know the specific situation in Westchester County at this point, but clearly New York is, at the moment, the epicenter of the outbreak in the U.S. The most cases are spreading within the city and the state more broadly. And this is not unexpected at all. This is how viruses spread. This is how epidemics and pandemics spread. They start in particular areas, they get seeded in those spaces and move outward into other areas. So anyone who's listening to this that says, well, it hasn't come to me, it won't come to me, fortunately, that's not likely to be the case. It will reach everywhere.
One of the things that's been discussed recently is the concept of shelter in place, and I know that there's many villagers who are already effectively doing that, but can you explain that and the rationale behind it?
Sure. Just try to think for a moment from the virus's perspective. A virus essentially exploits what it is to be a human, our social connections. A virus travels on us, travels on our skin, in our secretions. It is spread when we come in contact with other humans. So if you want to stop the virus from spreading, you essentially have to stop doing an important part of being a human, which is to connect socially with each other. So we ask people to shelter in place, which means basically stay within one physical space so that they're less likely to come in contact with other humans and other people who might actually have the virus. So it's very simply a form of what we would call reverse quarantine or isolation. There's various terms that describe this, each one. Some have specific meanings in epidemiology, but for this case, we're just trying to separate ourselves from other people so we don't catch it.
Okay, that makes sense. If I need to go to the market to get food to survive, what's the safest way to do that?
Well, I think people need to think in terms of their risk profile. We know that, and by the way, this data is evolving day to day, but we know that generally older people seem to be more at risk for the most serious complications and death from this virus. So if you are at super high risk of this because you are immunocompromised in some way, chronic disease, you're not healthy without any other health conditions, you are probably should avoid going to the market at this point if you can get someone else to do that. That's the safest thing to do. Just totally separate yourself. If you do go to the market and you are healthy, then there is a small chance you might come in contact with the virus. So you need to protect yourself. So we do that by washing your hands. Now, if you want to be a good neighbor to all the other people going to the market, wash your hands before you go to the market so you're less likely to spread the virus to other people. Wash your hands after you come back from the market. When you're at the market, and many supermarkets are doing this, they provide wipes for carts and things like that. If you're only getting a few items, don't even use a cart. Just carry them for yourself. So you just want to avoid touching things. I mean, the virus, yes, it does float in the air for a period of time, but people feel that the most common way to catch this COVID-19 virus is by touching something and then touching your nose, your mouth, which is what we do all the time, of course. And you just want to stop doing that. Or if you are going to do that, make sure your hands are clean. So hand sanitizer and all that. All that hand sanitizer people bought, they should actually put it to good use and just use it when they do go to the market.
It's amazing when you start to actually pay attention how many times we actually touch our face, even over the course of a few minutes.
Yes, I do that a lot. I know that about myself. And so I have to recognize the reality that as much as I try, I will not stop doing that. So the alternative, again, this is a layered approach here. The alternative or the additional thing you should be doing is using a hand sanitizer or washing your hands.
Here's a question that we've heard a lot, or sometimes it's a question, sometimes it's pushback, and it goes like this. My household has 2 teenagers. We're all healthy. They each have a best friend whose whole family is healthy. What's wrong with them hanging out together?
Yeah, that's a tough question there. If it was just those 2 families and they don't hang out with anyone else, then maybe that's okay. The likelihood of somebody being in there. But here we have a couple of problems with that. One is there is a lag with this virus. You are exposed to it, you become infectious, and days later you become symptomatic. And we are now learning that some people may never become symptomatic. However, from the time that you have that virus, you first get it, you could be spreading it. So someone who could look perfectly healthy could be a carrier of that virus, and you need to avoid them. Now, if that person's in the other family, they picked it up a week ago, they are still spreading it, then you are increasing the odds that you're coming in contact with the virus. The more people you come in contact with, more likely it is that you're going to develop this disease, catch the virus and develop the disease. Also, studies from China show that a lot of the spread is actually even within the household. So we're telling people stay within your household, but another level would be to actually separate yourself from the people in the household if you are exposed in some way or think you were exposed to the virus. So those are pretty draconian measures here, and not necessarily recommending that. But what we want to do is just reduce the odds that somebody come in contact with. And let me just add one point to that. So, we say you limit your gatherings to 10 people. That's an arbitrary number, but what it really is statistics. It's the fewer the number of people, number of contacts you have, the less likely it is that one of those contacts is going to have the virus and give it to you. The more the number of people, the greater the likelihood, which is why we tell people to avoid large gatherings.
Yeah, can you explain to anybody who may be on the fence or is not worried about this because they don't think they're in a risk group, why they don't want to be hospitalized in New York about 3 weeks from now?
The term hospitalization is going to take on a whole new meaning when you're being treated in a facility that doesn't look like a hospital or any hospital that we know. It could be the Jacob Javits Center. It could be some other facility that they're putting people in who have the illness but not very severe, and reserving the ICU beds and the ventilators for those who absolutely need it. And if you look at Italy, and that's the cautionary tale for everyone in the United States, Italy could be us in a couple of weeks. And that is really, really scary because we do not have the resources to manage and handle the surge of cases that could occur when mass numbers of people get this virus. So the approach to trying to manage this situation is one of 2 things. One is let's increase the supply of medical care by opening up new facilities, bringing in retired doctors and nurses, bringing in students who are just about to become doctors and nurses and other health professionals. Let's bring as many as we can in. So you're increasing the supply side of the equation here. But there's a limit to that. You can't rapidly build ventilators at this point, though we should be or should have been. It's another thing we can talk about. And on the demand side, all of us have a significant responsibility to make sure we don't get sick. We do not want to clog up the system. We want to stay as healthy as possible so that those who were unable to avoid the virus will be able to get the care that they need.
Let's imagine that I'm the kind of person who's very prepared and, was, thinking about being a survivalist or something like that, or just nervous. And when I first heard about this, I went out and bought some N95 masks and then 1,000 surgical masks or something like that. And they're in my pantry now. Do you have any advice for folks like that who might be in the community or in the state?
Well, I have heard stories of, and you probably see the same things on the media describing hospitals looking for these supplies. So if you can reach out and provide them, need them, that's great. And remember, it's not just the hospitals, the acute care facilities are going to need that. Nursing homes, skilled nursing facilities are going to need that. People who are going to be working with people who are sick are going to need those provisions. Look, in an ideal world, everybody would have plenty and plenty of masks, and we all be able to wear them, even though it's not necessarily recommended at this point. It would still provide perhaps some level of protection. That's what they're doing in Asia. But we have a limited supply. That's the reality that we're in right now. So we want to make sure that the people who absolutely need it get it. And have that, the ones who are at highest risk. And frankly, as they talk about, firefighters run to the fire when everyone's running away. The healthcare workers are running to this outbreak. They're running to the sick people. They want to help. And we want to provide them with as much protection as possible. One is it's a selfish reason. I want that doctor or nurse to be there when I need them, if I need them. And also because they're putting themselves at risk and they should be protected to the greatest degree possible.
Absolutely. And obviously the doctors and nurses with the most experience are the most likely to fall ill as well, right?
Well, not necessarily. I mean, you would think if they had the greatest experience, they know how to protect themselves. There are countries in which none of the healthcare workers get sick because they have put in very, very precise protocols for managing the patients who have this virus. And they follow them, and they have the resources and equipment necessary to do that. I saw almost a very disturbing image comparing what nurses were wearing in different countries, and the nurse in our country was the least protected.
Right.
We like to think of ourselves as the most advanced society in the world with the best healthcare system in the world. In reality, we look like almost a developing nation for what we are providing our people here.
Right.
And there's a whole policy question that's going to need to be addressed when this is over. Why? Why weren't we ready? Which is nothing.
Yeah, I was just thinking that in the absence of great personal protective equipment, that the doctors and nurses who are old enough to be approaching retirement are actually potentially at more risk if they do catch the virus.
There are more risk for a complication of the virus, but probably at the same or lesser risk of actually getting the virus based on their experience. Everyone can get this virus.
Sure.
Nobody is immune to this virus. The entire population is susceptible. That's an important point. But we are seeing that young people are also being hospitalized. I don't remember the exact statistics, but somewhere close to half of the people who are being hospitalized are under the age of 55.
So does it distress you when you hear, as we do, reports of teenagers playing basketball and hanging out in parks or flocking to the beaches? We don't have beaches here in our village, but we do in our county. Not that you want to be there in any case right now. But are these close personal gatherings helpful, or are they potentially furthering the spread of the virus?
Oh, they are furthering the spread of the virus. I can almost guarantee that. I mean, the terms you use are close and personal. I mean, again, the virus is exploiting what people want to do. Teenagers, young adults, they want to get close and personal with each other. And the virus will will be transmitted through those connections. Now, it's particularly worse when you're talking about, say, spring break, and we've all seen the pictures of the kids gathered on the beaches, and I'm not going to get this. This is not going to be a problem. Or I'll go and get it that bad. They turn out to... they catch it, they spread it to each other, they get on an airplane or they get back in the car, they drive back to their city, and what you've done is seeded this outbreak in every community. And you can't imagine a more perfect way to spread a disease than to take a bunch of people, hot and sweaty, running around, sharing bodily fluids, then put them on planes and then in trains and automobiles and send them out to various communities And now we have essentially spread this all over the country. And it will hit over a period of weeks. We'll begin to see it. I would love to be wrong about that. I would love that there wasn't any spread in that condition, but we'll know for sure who's right and wrong in 2 weeks, 3 weeks, when the cases start to mount up.
One of the very mundane questions that people ask us is in the matter of walking their dogs. So first of all, if I have an adjoining yard with a neighbor and our dogs get along well, can one of us open the gate and let the dogs play together? What risk does that present? And then second of all, if I'm just out walking a dog and another dog approaches and I can stay 6 feet away from the owner, does that present a risk to me?
I would say it presents a very small risk. I mean, there is no such thing short of going into a bubble somewhere to protect yourself from this virus. But because, it's a layered statistics thing, the odds of that being that interaction you have with your neighbor and your dogs interact, transferring the virus to one to the other are small. Add to that, your chances of actually catching the disease are less. And so you add up all the statistical risks there. Yeah, there's a risk. It's always a risk in anything, but it's probably a much lighter risk than if you were shaking hands and giving them a hug and a kiss. So that's let's be careful about that. The current thinking in this country is that we can go outside, we can walk, we should just stay 6 feet apart from each other. That dogs can't carry this virus. They could carry it on the surface of them. So if you're concerned, you can use, when you brush the dog or pet the dog, put on gloves and or bathe the dog if you're really worried that maybe it was exposed. But if you are feeling poorly that morning and you are coughing and sneezing, then maybe you shouldn't be out there walking with your dog so that you come into contact with your neighbors. That's the neighborly thing to do. So let's try to understand where we are in terms of our risk profile and do the best we can.
One of the things that lots of parents have learned over the past week is that doing distance learning with 2 or 3 or 4 kids while trying to work full-time jobs is taking a toll of its own. Do you have any advice? And I'm particularly actually thinking of your background in public health, looking at other either pandemics that we obviously haven't lived through, but you've seen from a historical perspective, or other health crises that could tell us something about how people cope in these situations?
Well, I think we're going to see a whole variety of reactions with regard to teaching kids at home. I love the little tweets and people making a comment. I really feel now I understand what my child's teacher has gone through. And I'm going to want to make sure they get paid more. So one story of a woman who walked out the front door, said goodbye to the kids, came back in through the window into her office so that their kids wouldn't know she was there. She knew they wouldn't leave her alone. So there's all these lovely little stories about that, about what it's like to be cooped up with your kids, especially if you are following the advice of some experts who are saying you shouldn't even have play dates, in which case you can't even do that, depending on your approach there. So yeah, I'm very concerned that we're going to see, let's call it an epidemic, a secondary epidemic of PTSD as a result of this.
Right.
So people who already have underlying conditions or are prone to anxiety and depression, I mean, this is a time when being anxious and maybe even depressed is almost a normal reaction because of what's going on around us. So how we manage these feelings are going to be particularly important. So I would certainly recommend, and I'm hearing from my friends in the behavioral health community that they're starting to stand up all kinds of phone services and video conferencing and all kinds of ways to connect with people that in a way that's going to help support them when they're having difficulty dealing with the situation. The very words that we use, the popular terms now, social distancing, isolation, quarantine, these public health terms are scary. And these are the things we do not want to happen in our society. We have an epidemic of despair, diseases of despair, where people are dying because they feel a sense of hopelessness, and they're more prone to drug abuse and other situations that put them at risk for an early death. And this is only going to make it worse because part of why that's happening is because people are losing social connections. So this is an opportunity for us to reach out in the ways in which the virus can't spread. Connect with people in different ways that the virus has not figured out how to take advantage of. We're doing it right now through this screen here. And the facial contact and our interaction is better than a phone call. If you have the ability to do that, people should be doing that. Reaching out to people that they haven't spoken to in a while, especially people who may not be as socially connected, and making sure they're somehow touched in a way that the virus can't spread, but still feel like they're part of this world, which I think will help to alleviate a lot of the anxiety and depression and all the situations we're going to be seeing going forward. In addition, you look at what's happening in Italy. They're locked behind closed doors, but they open their windows and they sing. There are videos of that on the internet, and the virus can't travel on a song. And so people are connecting with each other in important ways. And I think we're going to see incredible innovation and heartwarming stories about people helping each other. Stories about young people delivering meals to older people, delivering food, going shopping for them because the older people are afraid to leave the house. These are the kinds of stories that we need to emphasize. And when you're talking to your own children about this, you need to say, look at what people are doing positively, because they're going to feel lost, they're going to feel at sea, and they're going to see their parents scared, which is the worst thing for a child, because that's the rock. When you say, wow, if my mom or my dad is having trouble here, what could possibly happen to me?
Right.
So for parents, they need to emphasize the positive and how the world came together. And even if that young child is just drawing up pictures and you're mailing that or somehow getting it to a local senior center so that the seniors who are isolated in that facility can see something, that's an opportunity as well. And I really feel that we're going to see an incredible amount of innovation in that regard. Just this morning, for instance, you got the story of kids not going to school. And for some kids, that is not just they're missing out on their education, they're missing out on a meal, they're missing out on nutrition.
Yeah.
So the school system is using the buses to deliver the meals. They're not picking the kids up, but they're doing all their usual stops. Kids come out, they pick up their lunches. And the bus driver says how wonderful it was for him to see the kids because he felt like he missed them. And he wanted the kids to know he had their back by providing them with the meals. It's those kinds of stories we need to emphasize, and those are the opportunities we need to track.
And I should let Village of Pleasantville residents and people in the school system know that we are working, encouraging a private solution where a number of villagers are putting together a fund to help local parents who cannot afford lunches to provide for them in the short term, before hopefully there's some help from the federal government overall.
That's right. I mean, that's fantastic that you're doing that. And this is an opportunity for the volunteer community, for all of us. We are all volunteers in this outbreak. Step up and do something. And look, if you're making sandwiches for these kids, invite your kids to get involved to do that. And I think when you get to the question of the what do we do with these 18-year-olds, which just basically have nothing to do at this point, I mean, that to me is a shame. We need to engage them. I think young people really want to be engaged. And to be told, well, you don't have any role in this except to sit back and cough into your sleeve and wash your hands regularly. I mean, we need to give people more than that.
Right.
And we need to turn this around. I mean, I got into this business of public health preparedness and pandemic and bioterrorism and all that other stuff after 9/11. And one of the frustrations for me after 9/11 was the message to the vast majority of people in this country was, oh, just go back to the malls and shop again.
Right.
Your job is to save the economy. Just go back to your lives. Ignore what really, or you can memorialize what happened in official ways, hang a flag, do those kinds of things. But there wasn't a call for communities to come together to say, you know what, we're going to prove that we are so much better than what happened to us by coming together and actually making our society even stronger from the ground up. We didn't do that. That wasn't what our leaders called upon us to do. And I'm afraid that might happen now. So for your local leaders, they need to call upon people to come up with the most creative and innovative ways possible. And there are going to be some crazy ideas out there for what people want to do, but it's a way for people to feel involved and engaged. And that's what I would want them to do.
So we need to find a way, particularly for the people who are seniors who may be living alone, to be together, even though we have to be distanced.
Right. My mom passed away January 1st, before all this was really happening. And her technology skills were very poor. So it wasn't like I was going to be able to give her an iPad and say, hey, Mom, I'm going to check in on you every day. So that would have been a really significant challenge. And I knew if she were alive today, I'd probably have to move in with her and provide protection for her, basically, quarantine myself with her,
right?
In order to make sure that she would have been functional, because there was no other way that was going to occur. And I would imagine there are other people out there. So yeah, technology is going to solve some of these problems and ways for people to connect, but we have to come up with just some more traditional ways. And even again, I saw some video on the television last night about they bring the dog that goes around the nursing home. He's looking through the glass at all the people inside and who are isolated within that nursing home, because he can't be with them because they're at higher risk. So they're just, there are ways that, as best we can, try to connect with people so that they're not feeling separated and exacerbating this isolation.
So just to close this out, can you maybe to end on a high note, could you give us something that you see in the world that gives you hope?
Well, I guess and one is all these positive stories I'm describing here. That gives me hope. The spirit of people in that innate desire to come together in a way that thwarts the virus's true nature. I also believe we will come up with very innovative solutions for dealing with this disease. The research is underway looking at everything in the medicine cabinet eventually to see if anything will work at stopping this disease when it hits people. Of course, we're working on vaccines, but that's going to take some time. I also think we're going to come up with innovative ways to find out all these people who have been exposed to this disease but never showed symptoms, finding out whether they are no longer contagious. Once we begin to test people to find out, we look at their antibody titers for that purpose, then we will be able to get to the root of the problem by truly knowing who's at risk and who's not at risk, and then we can be a little bit more specific in our quarantine requirements and our lockdown requirements. So only certain people would need to be at that point protected. And this is we'll hear more about that as this pandemic moves through the country.
Hey, Dr. Harris, thank you so much for your time. Really appreciate it. And we'll be back for the Village of Pleasantville. We'll be back with more videos. Thank you.
Stay safe out there. You're welcome.